Thank you everyone for coming on out. We just want to provide notice about some fairly simple things that we need to take note of as a community as we move forward in this opioid, opium, heroin addiction crisis. And I want to thank the sheriff for letting us use this facility to have this conference today. And thank you all for coming, because we need to get the word out. I am Todd Williams, Buncombe County District Attorney, and in that role, I want to preface our remarks about heroin, fentanyl, carfentanyl, and what we're dealing with here as a society here in Western North Carolina and nationwide. This provides unique challenges in terms of the administration of justice. It is always the district attorney's job and role to seek justice, simply. And my office has a treatment-oriented philosophy. And if Mr. Creighton, there are folks who want to come in, but everyone who wants to come in should come in. So, back up and restate that my office has a treatment-oriented philosophy, but we've got to balance the enforcement of our criminal laws with treatment and our discretion. That being said, we have a situation where heroin and opioid substances are going into the black market on our streets, and it is the body count, the overdose cases are skyrocketing because we're dealing with ever more potent cuts to street drugs. This slide here shows the relative dosage units of heroin, fentanyl, and carfentanyl. We've heard a lot about fentanyl. Carfentanyl is something that is new and is coming into the Atlanta market per the DEA, and if it's coming into Atlanta, it's more than likely coming into Western North Carolina. Carfentanyl is a veterinary application. It is 1,000 times more powerful than fentanyl, and it's generally called elephant tranquilizer. And that is working its way into the cut of street drugs into at least half a dozen or more markets here in North America, including Atlanta. This is going to tackle this. It's going to take a multi-pronged approach. Again, treatment is a primary focus. We've spoken with attorneys and county government officials in terms of participating in civil litigation. The DA's office is fully engaged on this in this crisis, and we're seeking to reduce the incidence of overdose in our community. So I've got some slides. This is obviously the slide that is labeled "inherently dangerous drugs," and that phrase is key in the prosecution of. We'll come to a slide later that references what inherently dangerous drugs are. Carfentanyl. This is a slide I grabbed off of just a Google search. Carfentanyl is so toxic that, as you read here, an analysis was done of victims in this 2002 Moscow theater hostage crisis. An analysis was done of urine that was passed in the remains of victims in this crisis that indicated that carfentanyl was aerosolized and used to gas the Chechen terrorists in this 2002 hostage taking in Moscow. Carfentanyl, therefore, has been weaponized. It is that potent. And we've seen these kinds of graphs. This is obviously something from the CDC. We've seen these graphs numerous times in media. The movement, the most dramatic movement is here on this orange axis. Other synthetic opioids, fentanyl, and I imagine carfentanyl would be a subgroup of that. You can see that the spike is here on this axis. I put together this graph, and again, this is from Emergency Services Director Jerry Behan, who is here. Thank you so much for coming. I guess the cogent thing to point out here is these are January through September. I think the orange graph is most useful. Emergency management system overdose calls over the past 3 years. Again, that's the first 9 months. And we've gone from 160 or so overdose calls to more than 350. And again, this is sort of a barometer. This is a measure that obviously it doesn't encompass all overdose calls in this county, but it does show that if this axis continues to go in that direction, we're looking at some really scary numbers here in the next 2 or 3 years. And if you combine that with the possibility that carfentanyl, something that again is another order of magnitude more potent than what we're already looking at, it's scary. The Citizen Times reported on this in the last week or so. Skyrocketing overdosage visits to the ER admission, 84 to 230. And this slide is basically a summary of what we're offering in the DA's office. In the exercise of our discretion, a user should have multiple opportunities to access treatment through the court system if there is an arrest and there is a prosecution. I'm very excited about prosecutor-led diversion, which is coming out next month. I want everybody to stay tuned on that. We're going to do a press event for that. We've partnered with numerous local agencies, some of which are here today, VIA Health and Sunrise Recovery. Another tool that the legislature has given us is Section 9096. Someone who's charged with a drug offense can come to court, plead guilty, get probation, and get it expunged, get it dismissed and expunged on the back end. Again, conditional discharge and probation is another path of recovery for an offender. And then ultimately, we've operated in Buncombe County for approaching 20 years, I guess 18 years, drug treatment court. So there's multiple layers for an offender to access treatment through the court system. So I don't want today's message to be conflated as a zero tolerance policy or 3 strikes and you're out. We're not doing that. We want to compassionately address this issue with the resources that we have, but we have to make it clear that if a user's problem is metastasizing, is becoming, needs to be subsidized through the sale of drugs or trafficking of drugs that are cut with fentanyl and carfentanyl, there are going to be there has to be consequences because we have to balance community safety with justice, the interest of justice. There's a way to get rid of your prescription drugs, and there are 3 locations. Perhaps the sheriff can address that, but right here at the courthouse is one. If you've got prescription pills, bring them on in, get rid of them. We got to remove these things from the pipeline. VIA can connect you with services, and Donald Roos from VIA is here today. This 800 number, please include that in your reporting that VIA is able to connect folks with Recovery at Sea, 356, and other agencies. And I put this up simply because I want to show that the legislative intent is clearly expressed. This statute is effective December 1st, 2017. This was part of the STOP Act, and the second-degree murder statute has for years included the distribution of inherently dangerous drugs as a prong of prosecution for second-degree murder. And just in the last legislative session, the legislature has struck opium and moved on and included opium, opiate, or opioid to include fentanyl, carfentanil, and these other toxic cuts that we're seeing in the street. So this is to say, and this is, again, doing justice is providing notice to the community. We're providing notice to the community that if you're using drugs and to support that drug use, you're selling. And what you're selling is laced with toxic substances that are inherently dangerous. And someone overdoses and dies. The legislative intent here in North Carolina is this. This is a possible prosecution. We will always exercise discretion. We will always look at each case by case. But second-degree murder is a possible charge for selling drugs if someone ends up dead as a result of that sale. So I need to be very clear about that. And last, I just want everyone to kind of take this in. Trafficking in heroin, opium, opioid controlled substances are Class C, Class E, and Class F offenses. Class C is more than 28 grams. Class E and F are here. 225 months. We're seeing that kind of, we're seeing 28 grams or more coming in our community with ever more frequency. It's coming from Atlanta, it's coming from Charlotte. The sheriff informed me yesterday that North Carolina is now identified by the DEA as a hub, transport hub for the trafficking of these drugs. So we want to put not only our community on notice, we want the message to go out to the other nodes of distribution that 225 months is what you're looking at if you're bringing 28 grams or more into our community here in Buncombe County. So it's a simple message. We're going to use what we've got in terms of second-degree murder, these trafficking statutes to protect our community, but we're also, in the exercise of our discretion, providing access to treatment, coordinating with other agencies to ensure that people get the recovery they need. So this is the DA's dilemma. This is the district attorney's dilemma. We're trying to enforce the law. We're trying to do it compassionately and do it in a way that protects our community. So with that, Mr. Mahoney, would you like to?
Appreciate it. The only thing that could get me in front of a bunch of people with cameras is this message, because this is my least favorite thing to do in the world. But the message is my favorite thing to talk about. And that is, on any given day, I work in the grassroots, frontline community, dealing with homeless, indigent, people who live in campsites, people who live off I-240 exits. My name is Kevin Mahoney, and I'm the director of Sunrise Community. Sorry. There's not a day that goes by, a week that goes by, that's 2 to 4 people pass away in the community due to this stuff. It always astounds me, the numbers. And on a good week, nobody passes. But again, on an okay week, it's 2. I will always hear people coming in from the NAA community. Did you hear that so-and-so? I heard last Thursday that somebody I work with in the homeless community overdosed, came back, they gave him Narcan, and he went out again the same night and passed away. So it's insidious, it's got deep roots, it's got roots in trauma, it's got roots in history, it's got roots in institutional addressing of this problem. Rather than look at it as, I mean, we don't look at it as a disease, but it is. So what Sunrise does on a non-clinical, non-therapeutic, non-medical level is to address all the things that cause this stuff, all the social situations, the economics, the education piece, the trauma piece. We're all peer support specialists. This is like everybody in my organization has either had experience with substance use, mental health, and the legal community. So we've been there, we've done that, which gives a little more authenticity to our message, because we said 15 years ago, I was homeless, and I was about ready to kill myself, and I tried to. And I'm in front of you now in a different capacity as a survivor, and not just a survivor, of somebody who's starving. I literally have to wake up every day and go like this, going, what has my life turned into? I'm super grateful. The thing that we're helping out directly with the DA's office, and it was at the behest of the DA's office, we came in to speak with them about doing a diversion program at the felony level. So what the Sunrise Felony Drug Diversion Programs is helping people with little or no records who are facing felony possession of Schedule I or Schedule II controlled substances, specifically opiates, as a direct response to the ongoing battle our community fights against the severe damage that heroin and fentanyl-laced causes to victims and their families. So we collaborate with the DA's office, and we take referrals from them. We're going to shoot for 30 folks that hopefully we can save and put back and attach to community. And it's not just educating people, it's giving them something to hold on to that's bigger than what they're doing now. If it's something to get them out of bed, something to say, I belong to a community and it's greater than myself. Sort of like the higher power from NAA, but again, the community attachment piece saved my life, and I want to give that gift back to other people. Some of the other things that Sunrise helps out with, again, with that recovery wheel, the social supports, is we're trying to get a card put in every doctor's and prescriber's office, dentist's office, that says, here's 5 questions to ask your prescriber. Do I need this drug? Is there something I can do that's not an opiate-based? How long do I have to take it? What should if I don't feel like finishing, what should I do? So again, the 5 questions, I want to get it out in the medical community, because that's one piece of the problem. And I've worked with doctors, and they're kind of wrapping their heads around the non-therapeutic and non-medical supports, like peer support. Again, we have our diversion program, we have daily education programs, face-to-face peer support, one-on-one visits. We run a program called Access to Recovery for veterans and students that's substance-based, mental health-based. We fund the domains of wellness, money management, spirituality, education, physical exercise, and also just giving that authentic message of, I've been there, I can help you. I can't do it for you, and your program won't look like mine, but we will craft you an individual program that would kind of get you out of harm's way. And we also run a community action committee. Thanks.
No, I wanted to ask you a question, and it's basically a simple question.
Okay.
If someone wants to make a change today, what's the cost to come and participate?
We're grant-based, so we complement other services. We don't charge anything for our services.
Where are you located?
We're on 370 Louisiana Avenue in office C4.
So if someone wanted to start a peer-to-peer recovery program,
Call us
how do they do that?
You can call us at, since I never call myself. Well, our number is 828-552-3858. And again, we also do walk-in too. You don't have to call, just come in and we can set you up with services. And one of the best things we do is navigate the health system, and it looks very daunting and scary from the outside, but once you get a navigator with you and saying, well, you can go to this person or you can go to this service, there's hosts of providers that do walk-in services too. We just get you to the door.
Could VIA also connect someone with
Absolutely.
Sunrise?
Sure. We partner with VIA.
All right.
All right. Thank you.
Well, yeah, thank you. And I do want to emphasize that we are partnering with folks who can provide these kinds of services, but this is the point. This is the message right here. I don't want this to be lost. We've got to address the trafficking of these substances, because it's killing people. Some of this stuff is, like I've already explained, has been weaponized, has been used by Vladimir Putin to address terrorism in his country. It's scary. Fentanyl's already scary. We're seeing that ever-increasing geometric increase in overdoses and fatalities in this community, and we're not going to arrest our way out of it. We have to partner with folks. We have to collaborate. But we need to get the message out, and that's what we're here to do today. I'll be around for a while. You all want to say anything? Anything we missed?
I will say I returned yesterday from Raleigh, from the Attorney General's Law Enforcement Roundtable on addressing the opioid crisis. And it's really a 3-pronged strategy. One is in prevention and what's going on in the medical field. They will tell you pretty quickly that some of the practices around prescribing kind of got us to where we are. When you look at the numbers, about 80% of the people who are addicted to, or who are heroin fentanyl users started with a prescription drug, whether that was diverted or whether that came through a prescription, about 80%. That's how they get there. So there's a lot of things on the prevention end, just knowledge, letting people know, prescribing changes. Then, as the district attorney was talking about, law enforcement gets it when it comes to people who have the disease of addiction and are in the throes of that. We're looking at ways to get them into treatment, remove that stigma, and try to help those individuals recover and return back to their families and return back to productive living. On the third piece of that, it's very strong enforcement. I can tell you there was a lot of time spent yesterday talking about how can we be better, cooperate better, communicate better, and be more effective in going out here and dealing with these people who profit from this plague that we're in the middle of right now. So it truly is a three-pronged strategy, as the district attorney said, and we're hoping that through the consistent pursuit of all three of those prongs, we'll move ourselves eventually out of this issue.
Yeah, thank you for emphasizing that. I mean, what we've discussed internally is, this is, there's a profit motive, and it's predation on folks who are basically, they're suffering, it's an illness, it's an addiction, and we recognize that. But the folks that predate on that are looking at these punishments. We'll be available for questions.
Right now with the Narcan kits, who all has them, who has access to them? Is it just first responders, law enforcement?
Right now, what we're seeing, and Jerry can probably speak to that better than I can. You're seeing a lot of these things that are being distributed through the Steady Collective, through WinCap, that we're having a lot of people who are saving individuals on the street out here. So when we do these numbers, which our numbers are 400 and something to 600 and something, comparing the same period in time last year to this year, that's not taking into account all those saves that happen out here who people have access to Narcan. Right now, our patrol has access to Narcan, and so does our school resource officers. And I can only see that continuing to increase, especially with the danger of carfentanil, and because it can be inhaled, absorbed through the skin, and anybody who's dealing with it, to include law enforcement who encounters it, can overdose.
And it's my understanding that with carfentanil, one dose of Narcan doesn't do it because it's so potent. I have this access here. The blue is Narcan doses, but that's only through the emergency management system. This is all through Jerry Behan's operation. The emergency services director provided me with these stats, and there are other agencies, fire departments, APD, law enforcement, that this doesn't even catch, but we are seeing a little gentle increase just at one agency. But this is why I point out the orange bar graph is more indicative as a barometer of where we're going here, and it's frightening.
To clarify the part of the North Carolina stop law that's going into effect on December 1st, was it always opioids was already underneath that second-degree murder statute, and then December 1st it'll include the carfentanil and fentanyl?
Well, generally fentanyl and carfentanil is used to cut heroin, which is already, it's an inherently dangerous drug. It was already part of the statute.
Okay.
But that is making it clear, and it's a clear expression of the legislative intent and recognition. Opioid is now included as a potential inherently dangerous drug that we know kills, and the legislature's recognized that and incorporated it into our second-degree murder statute.
Okay. So the opioid is what goes into effect on December 1st, being a part of the statute.
Right,
okay.
but as I said, that substance is generally used in conjunction with a street drug, which was already part of the statute. This is really indicative of just the legislature recognizing that the crisis in overdoses is stemming from the opioid controlled substances being used as cuts in the street. product. Does that make sense?
I think so, yeah. So the street drugs was already part of this statute, but now
Right.
they're just being more specific to
Right.
give it,
Exactly.
give awareness.
Well
Okay.
said.
So it's well known that like foster care rates are rising and the Department of Social Services is struggling because they say they just don't have enough funding. What's being done to address the family side of this crisis as well, especially the children that are being affected?
I'm not sure that I'm the best person to address that. And I don't know that we have someone here who can. Okay, we have a volunteer. If you would, feel free to come up. This is Tammy Shook. Okay. You're commended for your courage.
Good morning. My name is Tammy Shook. I'm the Director of Social Work Services for Buncombe County, and you are correct. This plague on our community is definitely impacting the children of our community, and not just in Buncombe County, in the entire state. 70% of the children who are in foster care currently in Buncombe County entered foster care because one or both of their parents had a substance abuse issue. Substance abuse is not new to child welfare. Substance abuse has been a part of what we have dealt with my entire career of 30 years in this system. But we are definitely seeing the impact of the opioid crisis, particularly on newborns. So babies that are born dependent on this substance because their mother abused the substance during her pregnancy. We saw an incredible increase in the number of children aged 0 to 2 entering the foster care system in the last 2 years, and we've put a lot of effort into fighting that. We have an embedded social worker on the mother-baby unit at Mission Hospital, where we are trying to interact with these families very early on via that, and 2 prevention workers who can engage with moms prenatally if they're willing to do that, to make plans for safe discharge from the hospital for them and their infants without them coming into custody. So we do need foster parents. We are always in need of foster parents, and if you are interested in that, please contact our agency, and we'll be glad to talk with you about that. But it is definitely impacting child welfare, but it's usually, actually, it's just the latest drug that's impacting child welfare. There's always been drugs that have impacted child welfare, and I'm happy to hang around and answer other questions.
Anyone else?
Can you give us any description on this prosecutor-led diversion that's starting next month?
Well, Mr. Mahoney did. He gave you a preview. It's frankly, it's a carrot and stick kind of approach. You have a charge, you comply with diversion, get a dismissal. You work on your issues, you stay clean, don't pick up new charges, do a program. It's structured so that there should be at least weekly meetings and group peer-to-peer therapy, together with some other things. We'll get into this is just a preview. We'll get into it next month. But the idea is that we get compliance, we have no new criminal charges, and we restore the individual without prosecuting and a prosecution that results in a conviction. Right.
If you could just reiterate why now, the importance of this conversation now. We see the numbers, we see these
Well,
drugs.
the Citizen Times reported last week in regard to the spike from the numbers from Mission. I have an assistant who went to a DEA conference down in Atlanta. We learned about carfentanil. He came back. He pretty much inspired me to make this announcement to our community. And people are dying. When is the right time? If not now.
Some of the things that are out there right now, I talked with a group yesterday who does work with people who are in the throes of addiction, and some of them are polysubstance users. Some of them are actually moving back to a different drug because the opioid fentanyl thing has gotten so dangerous. One of the things that's going on right now is there's pills being pressed where fentanyl's being used as one of the main active ingredients. And they actually have a head stamp of a different drug. So they're pseudo and made to look like a benzo or some other type of drug. And an individual who would normally use that drug, whether they would cook it up and inject it or whether they would snort it, or overdose and die. So I think I'd be remiss if I didn't put that out there. The danger of using, especially the opioids, especially the heroin, the fentanyl-based heroin, and it's hard to find anything out there that doesn't have fentanyl mixed in with it, is just so dangerous. It truly is like taking your life in your own hands. There's as good a chance you won't survive as you will if you're using those drugs right now.
Thank you all.